Ladies and gentlemen, I'd like to welcome you into the post-antibiotic era. And that's a terrible thing. The post-antibiotic era is an era of disease and antibiotic-resistant bacteria that don't respond to any drugs that we have currently. In 2011 in California, there was an outbreak in hospitals where 350 patients presented with antibiotic-resistant bacteria, what they're calling superbugs. These superbugs presented with MRSA-like symptoms, open boils and lesions and sores that ooze pus all over the hospital. And there's nothing we can do about this. All you can do is sit back and watch and wait. You can hope that you'll survive it, but without these antibiotics using it, we're back to 19th century levels of care. And the scary thing is that the CDC says in the 19th century, skin infections such as these had a 1 in 9 mortality rate. So if we go down the line, 1, 2, 3, 4, 5, 6, 7, 8, sorry. It's an epidemic that's waiting to happen, something that we can't fix right now. But luckily, science is on our side. Just as disease is always evolving, so is science. At least it was, and it's still trying to. But with the Sequester Act, the National Institute of Health and like foundations are crippled. The Sequester is a series of automatic budget cuts that are set to reduce the federal deficit by $1.1 trillion, with $85 billion of those cuts going into effect this March. Vanderbilt University lost $100 million of funding in their university medical center, and the NIH itself lost 5.5% of its total funding, or $1.5 billion. It's imperative that the U.S. federal government restores the funding of the NIH. This, and doing this, will help the American economy and the healthcare of our people. Today we'll talk about two sides of this. The first side is the economy. What are the economic benefits of research? What can we do with it? How does it stable economies when we fund research? Well, first of all, the NIH employs 1 million U.S. citizens, as reported by the National Institute of Health.gov. These 1 million citizens serve as the base for the local area and for the National Forum of Biomedical Research. It's found in a study by Trip Umbach in 2013, a leading medical consulting company, that for each dollar spent by the National Institute of Health on biomedical research, that $2.21 of net local economic growth is created. Well, if we look at Vanderbilt, this $100 million that we no longer have is the potential of $220 million of local growth in the Nashville area that we're losing out on. For the $1.5 billion lost by the NIH total, that's more than $3 billion of economic growth and stimulus throughout the area. We've seen that it stabilizes with jobs, but it also stimulates through growth. However, there's a looming problem with an aging population. As America gets older, the baby boomers are also getting older. And it's estimated by Ann Bottom, the chief scientific officer of the American Association of Medical Colleges, that by 2050, 11 to 16 million Americans will suffer from Alzheimer's disease. These aren't just Americans that we don't see. These are our parents, our professors, our friends, our loved ones. These are people that we see every day that might lose their memory, their idea of life, their function. 11 to 16 million people that we can't help here. We can with biomedical research. However, if we look at the economic cost of caring for these citizens, by 2050, there will be a total cost of $20 trillion. By investing in biomedical research and looking for preventative care now and in-game treatments as the disease progresses, we can save on these costs for the future, ensuring that we don't have to pay as much down the line and that we still have our loved ones that remember us and can live with us. On the other hand, we also have cancer that we look at. It's estimated by University of Chicago economists that a 1% reduction in the mortality rate of cancer has an economic benefit right now of $500 billion. If a cure is possible and found, it has a value of $50 trillion, or more than 3 years of the United States' total GDP. These are lives that we're saving as well as money for our future, stabilizing the economy, improving our health, and being able to circulate that back into the country that we love. On the other side of things, there's the healthcare and humanitarian benefits of funding healthcare and research. It's not just about dollar signs and everything. It's about biomedical research, what it's supposed to do. Improve our lives. It's everywhere around us, from Tylenol to cough suppressants and antibiotics. We see biomedical research in action every single day. Now, the National Institute of Health estimates that it takes 13 years and $1 billion to discover drug targets. Not cures, drug targets for diseases. So these 13 years down the line that we're not funding with this $1.5 billion, new diseases that evolve and bacteria that emerge, we might not be able to treat some of those. I'm not saying that we definitely won't, but with $1.5 billion gone, when we should be increasing this funding as these superbugs break out, that's a scary thought. So what would it really look like if a superbug happened? Well, like I said, it presents as MRSA. But what is MRSA and how easy is it to transmit? Well, first of all, MRSA and transmitting with antibiotic-resistant drugs is as simple as transmitting the common cold. It's shaking a judge's hand or talking to a friend or giving a boyfriend or girlfriend a kiss. It's going home and standing there with your family. You might not know that you have MRSA. I may have MRSA now, but we won't know that until a cut or something happens. Until there's a route of transmission, these diseases don't manifest. But once they do, we have nothing to stop them. Imagine around the school, people stuck in towers just like with the lice in Branscombe. But this time, it's sores and lesions and boils, oozing pus all over the floors. There's nothing we can do about that if that happens. That's why we need to invest in researching these antibiotics. Biomedical research can take us there, and it can improve our economy. Furthermore, if we look here at Vanderbilt University, we have Dr. Lawrence Swibel in the Biological Science Department that is researching and found a drug compound called VUAA1. This compound is thought to be at least thousands of times more powerful than DEET, the active ingredient in insect repellent. This compound can be useful across the world. It has convenience here on campus, but in areas like the Philippines where a tsunami just hit, fighting off malaria from insects with this thousands of times more powerful compound is able to save lives and improve lives across the world. We've seen today that healthcare is something that we need to think about. It's the economy that we need to think about. It's our loved ones we need to think about. It's being stuck in Branscombe that we need to think about. We have to worry and fight for this. By increasing the funding of the NIH to pre-sequester levels, the federal government will increase the health and the economy of the American people. Disease never stops evolving, so why should science? Thank you.